fascia, we want to be able to, again, have the foot to where the sock is off. It's cleared the edge of the mat. We want to be able to have our patient to clear that triplantar motion. We're going to do a slight abduction of the calcaneus because of where the fascia attaches to that medial tubercle. And then we're going to go into a sort of an everted position with the foot. So dorsiflexion eversion to get the most out of that thick fascia. And then the last little bit of the stretch is going to be the great toe. So adding in that great toe extension. Do you feel a stretch? Where do you feel a stretch?
The bottom of my foot.
And that's exactly where I would want it. Okay, so coming out of the stretch, and being careful with that toe, and then being able to repeat if I need it after 30 to 60 seconds. Now, the tibialis anterior is going to allow for the tendon to be very visible. That will help us to see, okay, it's going to dorsiflex and it's going to invert. So I just want to do the opposite. So I can see the tendon of the tibialis anterior coming here. So if that's going to show me dorsiflexion inversion, the passive stretch is just going to be the opposite of its motions. So opposite of the action would be a plantar flexion eversion. Notice how if I pull her foot without blocking, she's going to start to have a rotation or an abduction of the leg. So I need to make sure that my patient's foot has the sock removed, it's cleared the edge, and as I'm putting her into the opposite of its action, plantar flexion eversion, I have my force arm applied to the force that I'm wanting to provide to her, but I'm also blocking and stabilizing. The other thing I'd like to point out is that I'm not using my hand that's applying the force on her phalanges. So I'm working in her metatarsal range. I'm not going to the phalanges and applying all of my force on the toes. 30 to 60 seconds. Do you feel a good stretch?
Yes.
All right. So I can come out of that very gently. Now I could also apply that same stretch from the opposite side by doing a pushing motion instead of a pulling motion. But I just want to think about how my force is being applied. So again, you can see the tendon. If it's going to dorsiflex and invert, then I'm going to plantar flex and evert. And I'm going to do a pushing motion away from me, sort of pushing out. So down and out. The tibialis posterior muscle is going to do plantar flexion and inversion. And so having the tibialis posterior that's going to attach on all of those bones, think about the sustentaculum tali, all of the medial cuboid, it's going to go down to the navicular, it's going to have all of the different attachment sites. It's such a cool muscle. We want to be able to do the opposite of that action. So plantar flexion and inversion is going to be a dorsiflexion and an eversion. And so I can apply my force using the push away method, or I can be positioned opposite and do a pulling method. Okay, so plantar flexion inversion is its function, so dorsiflexion eversion. And notice my force arm is pulling it towards me and I'm blocking. Okay. The last one is, I think, the peroneals, correct? So plantar flexion eversion. I needed to dorsiflexion inversion. Okay, so having the peroneals, we're not going to be separating them into peroneus brevis or peroneus longus. We're going to do them as a group. And so just thinking about how they're running and the action that they're going to be performing, plantar flexion eversion, I need to do a dorsiflexion inversion motion. So again, I can be doing a push or pull. I need to think about how my force arm is being applied, and I want to stabilize so that I'm not going to be pushing the extremity into that motion or pulling it into that motion. I also don't want to apply my force onto the phalanges. And so I'm positioning myself to where I'm going to go dorsiflexion inversion. And so having a dorsiflexion inversion with my force arm applied so that it's a perpendicular force, and being able to hold that position, stabilizing so that I'm not allowing the whole leg to move, just the desired motion that I want to achieve at the ankle to get that stretch. Passive stretch, 30 to 60 seconds. Okay.